I'm talking about exercise and fatigue. Fatigue is the most common side effect reported by cancer patients. Exercise is a treatment for it, but it's not a matter of just smashing through or ignoring this fatigue. It's starting low and progressing slowly. So first, a definition: what is cancer-related fatigue? It's defined as being distressing, persistent, subjective sense of physical, emotional, and or cognitive tiredness or exhaustion. And the key thing is it's not proportional to recent activity and it interferes with usual functioning. The other thing about it is it's not alleviated by rest. In a subgroup of people, it persists for years. It is an under-researched area, more research required, and to date, most of the research has been done on females with breast cancer. So we have this guideline from the National Comprehensive Cancer Network calling for everybody to be screened for fatigue at the beginning of their cancer diagnosis, during their treatment, and at regular periods when they've finished active treatment. So this guideline calls for people to be asked about their fatigue on a scale from 0 to 10. 0 is no fatigue, 10 is maximal fatigue. The research has shown some people don't like these numbers and they prefer either the no fatigue, mild, moderate, or severe fatigue. Anyway, within this rating, it's recommended that if you have persistent fatigue, 4 out of 10 or more, or moderate to severe fatigue, this calls for a workup by your general practitioner. Fatigue is very complex. There's a lot of different things that can contribute to this fatigue. The good news is that a lot of things are treatable. So that's why we want your doctor to review you. So it might be, is a medication side effect causing your fatigue? And there might be an alternative medication, things like anemia, things like distress, anxiety, depression, which are treatable. Okay, really quick definition before we move on, because I'm going to be talking about physical activity and I'm going to be talking about exercise. Physical activity is basically anything where you're using your muscles, thinking, housework, gardening, going grocery shopping, that sort of thing. And then exercise is a subcategory of physical activity, which is planned and structured. Okay, so the idea of this program is a graded exercise therapy. So some people get into this boom bust cycle. They might think things like, oh, I'm undisciplined, I'm lazy, I can just, if I just push myself and smash through this fatigue, I'll get better. So they'll give it a go, they'll boom and then pay for it with the big bust. And this can go on for a while. So what we're trying to do initially is just find out where you are now with your exercise and physical activity, and then gradually increase that. We all know what life is like. It's not going to be a nice line like that. It's probably going to be a bit more, zigzagging up and down. So I encourage you all to keep a physical activity and exercise diary, and in there record your fatigue and your pain out of 10. And this way you can start to work out what is your optimal activity zone, and then from there start increasing your level of activity. And when we think about how we measure our progress, I just want a little bit of a mindset shift. So we might think, oh, our fatigue is just, it's not getting any better, I'm not getting any better, I'm not making any progress, but your activity is increasing. So I want you to think about the initial goal is to increase activity without flaring up your fatigue. When I first went back to work after my cancer treatment, in that first year, my fatigue was pretty much the same for a year. But when I first went back to work, it was only a few hours a week. And then, my hours gradually increased. What I was able to do at home increased. I could do more cooking, shopping, laundry, etc., more socializing, more of those meaningful and enjoyable activities. So although my fatigue subjectively felt the same, I was doing a lot more. Okay, so as I said, keeping this physical activity and exercise diary, recording that fatigue and even your pain, and then monitoring the response, and then adjusting your activity and exercise accordingly. I've also just put in here, if you were having a week where you knew there was a really big event at the end of the week, for example, a wedding, you might want to reduce some of your activity to save your energy. And I just want to emphasize again that persistent fatigue, moderate to severe, or 4 out of 10 or more, needs a medical review. For patients who are particularly fatigued, sometimes they may need to start with a mindfulness-based activity like yoga or Tai Chi. So they have strong evidence for helping fatigue. So I just want to let you know, fatigue is very complex. Progress can be slow, even if you're doing everything right. So give yourself a pat on the back for everything that you do, and have self-compassion for any setbacks. Another mindset shift might be, how can I incorporate meaningful activity into my life versus how can I make my fatigue go away? Because often it's incorporating that meaningful activity into your life will help as a treatment and reduce that fatigue. I just want to note that cancer-related fatigue has an association with inflammation. People with a history of childhood trauma process challenge differently and have elevated inflammation levels. People with depression also process stress differently. So that includes emotional, physical stress, and have an elevated response, an elevated inflammation. So if you have any depression or anxiety, or feel like you're highly distressed, or if you have a history of childhood trauma that's unresolved, I strongly encourage you to go and see a therapist. And I'll just show you this infographic showing the evidence, or the strong evidence, that exercise assists with cancer-related fatigue.